Medicare Advantage plans change each year, and Medicare Open Enrollment gives you the perfect opportunity to review your current coverage and decide if it still meets your needs. Any changes you make during this period will take effect on January 1st of the following year. Even if you're happy with your plan, it's important to know that changes can occur that may affect your out-of-pocket costs, your access to doctors, or your prescription drug coverage. This annual period, which runs from October 15th to December 7th, allows you to reassess your healthcare needs and adjust your plan accordingly. During this time, you can join or drop a Medicare Advantage plan. You can also switch from original Medicare to a Medicare Advantage plan, or vice versa. It's easy to assume that if you're satisfied with your Medicare Advantage plan, there's no need for changes. However, sticking with the same plan without an annual review can be costly. Medicare Advantage plans can modify their benefits, networks, and costs each year, potentially impacting your healthcare expenses. This year, service area reductions are a critical factor to consider, with over 2 million people expected to lose coverage. If affected, you'll need to find a new plan to avoid a lapse in coverage, which could mean switching doctors, adjusting your budget, or finding a new pharmacy. Additionally, your doctor might no longer be in the plan's network, or a medication you rely on could move to a higher cost tier. These changes can occur quietly, potentially leaving you with higher out-of-pocket costs or fewer coverage options than anticipated. One of the first things you should do when reviewing your current plan is to check your provider network, as changes here could lead to higher costs or the need to find new healthcare providers. Next, review the prescription drug formulary for any additions, removals, or tier shifts that might increase your medication costs. Also, pay attention to changes in premiums, co-payments, deductibles, and the maximum out-of-pocket limit. This limit is particularly important as it caps your annual healthcare spending. An increase here could significantly impact your finances if you require extensive medical care. By thoroughly examining these details, you can determine if your current plan still offers the best value for your specific healthcare needs. Another option to consider is whether to choose a Medicare Advantage HMO or PPO plan. HMO plans typically require you to use a network of providers and get referrals for specialists, but often have lower premiums and out-of-pocket costs. They're suitable if you're comfortable with a specific network and coordinated care through a primary doctor. On the other hand, PPO plans offer more flexibility, allowing you to see out-of-network providers without referrals, albeit at higher costs. PPOs are advantageous if you travel frequently or prefer direct specialist access. However, they usually have higher premiums and out-of-pocket expenses than HMOs. Your choice should depend on your healthcare needs, budget, and preference for provider flexibility versus cost savings. When it comes to reviewing and comparing Medicare Advantage plans, working with a licensed Medicare agent can make the process a lot easier. Licensed agents have access to multiple insurance companies and can quickly provide you with a range of options, saving you time and effort. They're also familiar with the ins and outs of Medicare Advantage plans, including changes that occur each year. A licensed agent can help you understand how those changes might affect your coverage, costs, and access to healthcare providers. With their help, you can feel confident that you're choosing the best plan for the upcoming year, whether that means staying with your current plan or switching to a new one. Remember, Medicare Open Enrollment is the perfect time to take a close look at your Medicare Advantage plan and decide if it's still the best option for you. With changes to coverage, costs, and provider networks happening every year, reviewing your plan is essential to make sure you're not caught off guard by higher expenses or reduced benefits. Even if you're happy with your current plan, comparing it with other options could reveal opportunities for better coverage or savings. Take the time now to review your options and get help from a licensed Medicare agent if needed. For more information about Medicare, please speak with a Senior Healthcare Solutions Medicare expert today at 866-633-4427. Thanks for watching. Like and subscribe for more Medicare videos.